Hello everyone. So let's start with the lower limb. In the lower limb, we will discuss many important topics. So I would like to start with the first topic of the lower limb. So before starting exactly the compartments of the thigh, I would like to start with the topic of lumbar plexus. So I would like to introduce you with the topic of lumbar plexus. Okay. So it is very important to know what are the important branches which is given from the lumbar plexus, and it is also important to know how the lumbar plexus is formed. Actually, lumbar plexus is the network of nerve. So actually, like the same way which we have studied about the brachial plexus, same way we have got the lumbar plexus, and it is formed by a network of nerves which is exactly giving innervation to the skin and the musculatures of the lower limb. So exactly, it is important to know it is formed by the ventral rami of, so if I talk about the formation, it is formed by the lumbar nerves. To be more specific, it is formed by the ventral rami of L1, L2, L3 and L4. So it also receives contribution from T12. So it is important to know that it is exactly not formed from taking the from the whole of the ventral rami of T12, but it takes a contribution from T12. Mainly, if I talk about the formation of lumbar plexus, it is formed by the ventral rami of L1, L2, L3 and L4. If I talk about the lumbar plexus location, it is located in the lumbar region and it is embedded in the psoas major muscle. It is just lying anterior to the transverse process of the lumbar vertebra. So this is exactly the location of lumbar plexus. Many important branches are given from the lumbar plexus. Individually, we will talk about each of these nerves and what are the innervation area, cutaneous distribution and the distribution and giving motor supply to the muscles. Okay, so here in this diagram you can appreciate it is taking contribution from T12, but basically it is formed by L1, L2, L3 and L4. So it is formed by the ventral rami of, L1, L2, L3 and L4. Okay, now important branches from lumbar plexus are iliohypogastric, ilioinguinal, genitofemoral, lateral cutaneous nerve, femoral cutaneous nerve, femoral nerve, also the obturator and accessory obturator nerve. Okay, so these are important branches of lumbar plexus. I would like to show you the table of distribution of these important nerves of the lumbar plexus. So let's talk about the individual nerves in this category. Okay. So let's start with the first nerve in this category. The first nerve of this category is the iliohypogastric. Now, iliohypogastric, basically, if I talk about its formation, it is formed major contribution from L1. So major contribution or formation is from the ventral rami of first lumbar nerve. But it also takes contribution from T12 and it is giving innervation to the muscles of anterior abdominal wall. So it is innervating which muscle? It is giving innervation to transverse abdominis muscle and also the internal oblique muscle. Other than that, it is also important for you to know that how it is forming the cutaneous nerve. It divides in forming two cutaneous nerve, which is anterior cutaneous and that of lateral cutaneous nerves. Now, the next is ilioinguinal. Entirely it is formed by the ventral rami of first lumbar nerve and it is giving innervation to the internal oblique transverse abdominis muscle, and it divides. When we are talking about its cutaneous distribution, the cutaneous distribution of ilioinguinal nerve is, it is giving and forming scrotal and labile nerves, anterior scrotal and labile nerves in respectively male and female. The next is genitofemoral nerve, which again divides into genital and femoral branches. So genital branch will give innervation to genital areas. Femoral branch will give cutaneous distribution of the skin, which is covering the femoral triangle region, and it is giving innervation to which muscle? It is giving innervation to cremaster muscle. So the root value is ventral rami of L1 and L2. So these are the first three nerves which we have talked about in the branches of lumbar plexus: iliohypogastric, ilioinguinal and genitofemoral nerve. Let's talk about the subsequent nerves. So let's talk about the fourth nerve in this category. The fourth nerve in this category is lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh. Okay. Lateral cutaneous nerve of thigh is again formed by the lumbar plexus. It is a branch of lumbar plexus which is formed by the ventral rami of L2 and L3. It is the cutaneous, the word cutaneous is its name. It's called as lateral cutaneous nerve of thigh. So its cutaneous distribution is lateral femoral cutaneous area. It is giving innervation to lateral aspect of the thigh region, and this is the whole area which is getting innervation from lateral cutaneous nerve of thigh. At times, the lateral cutaneous nerve of thigh get compressed by very tight clothing. If the person is wearing a very tight clothing, or in cases of tumor in this area, the lateral cutaneous nerve can be compressed and the person can complain of very painful. So he or she will complain a shooting pain or a pain, a tingling sensation pain has been seen in the lateral aspect of the thigh region, and this is the area of distribution of lateral cutaneous nerve, and the condition is called as meralgia paresthetica. So meralgia paresthetica is caused by compression of lateral cutaneous nerve of thigh. Sometimes the mode of compression can be a very tight clothing, tight pants, tight jeans, at times tight belts which has been used by the person, and it can lead to the compression of lateral cutaneous nerve. What is the condition? Meralgia paresthetica. Let's talk about the next nerve in this category, obturator nerve. Actually, many of this nerve which will be described in detail when I will give you the session of nerves of lower limb. Now, obturator nerve formed by the ventral rami of L2, L3 and L4. Actually, both obturator nerve and the femoral nerve is having the same root value. But if I talk about obturator nerve, it is formed by ventral division of the ventral rami of L2, L3 and L4. If I talk about femoral, it is formed by dorsal division ventral rami of L2, L3 and L4. So both obturator nerve and that of femoral nerve is having same root value L2, L3 and L4. Same root value, both are formed from the ventral rami, but obturator nerve is formed from ventral division of the ventral rami and femoral nerve is formed by the dorsal division of the ventral rami. Now, if I talk about obturator nerve, it is the nerve of medial compartment of thigh. If I talk about femoral nerve, it is the nerve of anterior compartment of thigh. That means if I am talking about this, so that means the obturator nerve is giving innervation to following muscles residing in the adductor compartment: the obturator internus and the adductor longus brevis and that of adductor magnus, also gracilis and pectineus. So all these muscles are the muscles of medial compartment or adductor compartment of thigh. The three adductors, the adductor longus, adductor brevis and adductor magnus adductor part, pectineus, gracilis, obturator externus are getting innervation from obturator nerve. Okay, and also gives cutaneous distribution in medial most part of the thigh. Femoral nerve is basically giving innervation to the muscles of anterior compartment. Other than that, femoral nerve is also giving innervation to iliacus muscle, which is coming from the upper region of the iliac fossa of the iliac fossa of the hip bone and inserts along with psoas major muscle in the lesser trochanter. So femoral nerve is the nerve of anterior compartment of thigh. It is giving innervation to quadriceps femoris muscle. This quadriceps femoris muscle is made of various muscle component. It is four-headed. It is giving innervation to rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. Also a small muscle which is derived from vastus intermedius, that is articular genu. Sartorius, pectineus and iliacus. So please don't get confused with this, that pectineus is also getting innervation from femoral nerve and obturator nerve. Actually, pectineus is an example of hybrid muscle. So you can just write here one point. Pectineus is the muscle which is an example of hybrid muscle or a composite muscle getting innervation from both obturator nerve and femoral nerve. Also, the femoral nerve is giving cutaneous nerves. The name of this cutaneous nerve is saphenous nerve, which is given from the posterior division of femoral nerve, and anterior cutaneous branches, anterior medial cutaneous nerves are given, which are the branch from the anterior division of femoral nerve. So in short, obturator nerve is the nerve of medial compartment of thigh. Femoral nerve is the nerve of anterior compartment of thigh. Femoral nerve is giving innervation to the cutaneous distribution in anterior and that of medial aspect of thigh, and also gives a saphenous nerve which will give cutaneous distribution in medial aspect of the leg and will go medially towards the great toe. If I talk about obturator nerve, medial most part of the thigh, a small area is getting cutaneous distribution from obturator nerve. Obturator nerve is the nerve of medial compartment of thigh. In this context, you can appreciate that pectineus is the muscle which is an example of hybrid muscle getting innervation from both femoral nerve and obturator nerve. So we have done with the 6 nerve in this category. I would like to tell you about 2 more nerves in this category. The 2 more nerves in this category are, so just focus here. Yeah. Okay. So if I talk about 2 more nerves in this category, we have got the short direct branches. These direct branches, the direct branches of L1, L2 and L3 will give innervation to psoas major muscle, which is an important flexors of the hip joint. Psoas major muscle is an important flexors of hip joint. If I talk about the short direct branches of lumbar plexus having the root value T12 and L4. So these branches which is having the root value of ventral rami of T12 and L4 will give innervation to quadratus lumborum muscle and lumbar intertransversus muscle. So these are short direct branches having the root value L1, L2 and L3 giving innervation to psoas major. Also quadratus lumborum and lumbar intertransversus muscle is getting direct innervation from direct branches having the root value of T12, L1, L2, L3 and L4. So in short, we have done with all the muscles and cutaneous distribution of the important branches of lumbar plexus. Okay, so it is important for you to know how is the lumbar plexus formed and what is the important distributing area and what are the important branches. Okay, so this is a very important topic and so many times the MCQ has been asked from the topic of lumbar plexus. So thank you, all the best. Let's meet with the next topic.